Hello, this is Thomas Hudson, the Talking Veteran, right here on the Talking Veteran Radio Network. Today we're going to be discussing with a nurse from the Jack C. Montgomery VA Medical Center in Muskogee, Oklahoma, concerning pain management. There is new trends involved in where veterans are receiving consults to go to outside pain management. You want to listen to this conversation? This is Thomas Hudson, and we're going to talk to Nurse Kennedy. Anybody in their right mind knows that anybody with tumors that spread from your colon to your liver and to your ducted of your pancreas, and on the last CAT scan showed that they have grown and are active, and then there's a possibility of something on the back of your tongue, because that's why they did a CAT scan on the neck last week, and then you had a fall on your right rib cage, didn't break anything but severely bruised, and then you have cellulitis in both legs. You would think someone like that would be in some kind of pain.
Well, let me share this with you. My husband is a veteran and does get his care here, and we have gone through this with them not providing pain medication, and he has had to go outside the VA to receive pain medication. So it's an ongoing issue with a lot of the veterans, and so I don't know, what to tell you as far as that's concerned.
You know what? I'm glad you shared that story because you can definitely identify it. And yes, that is a major problem with a lot of veterans across this country. That's the reason why states like Colorado, people are blocking their, so they could legally take something, not to be potheads with marijuana, but to relieve the excruciating pain. Mm-hmm. The problem, though, in going outside of the VA, like for instance in Oklahoma, it's now legal for medical marijuana. Well, right. Number one, it's expensive.
Yes, it is.
Two, and if you get caught with marijuana in your system, the VA is going to cut out any kind of ideal of having pain meds. I really don't blame the VA for this issue. I blame the U.S. government because an excuse that a nurse in another clinic gave me is that the CDC wants them to cut back. It is not my fault or any other, like your husband's fault, that back in the 90s, the pharmaceutical companies sold to the doctors that, this is not addictive, zero pain, and the government went along with it. Now they got a problem with a country that's become nothing but a bunch of addicts all over, especially in small town America, the new drug labs. So the ones that you see, like go back there to chemo, you don't think those veterans on that very, I call it powerful, I call it nuclear medicine. I mean, some of the stuff that's in those bags, it sounds like it came from some kind of nuclear plant. Those people deserve some kind of relief, regardless if someone else turned them in a bunch of addicts. The rest of the country. How do you balance that? Hey, listen, I want to think.
A lot of patients that are on hospice do not have an issue with receiving pain medication here at the VA or with cancer pain. What my husband did, he got a consult and a referral to a pain management clinic outside of the VA, and then of course, he does have a deductible, but that is becoming the only option for a lot of the veterans, because believe me, I hear this all the time, and I see both sides of it because I work for the VA and also I am a spouse of a Vietnam veteran, and I advocate very strongly for my husband. So it seems to be swinging that way, that patients are getting referrals the pain management clinics, of which you can choose where you want to go.
Now, I did not know that, but you said something about a deductible. What's about someone that does not have the proper insurance? Will the VA cover that?
Well, if you have VA coverage, I'm saying he has a deductible because he doesn't have any disability rating. So if you're,
Oh, okay. I understand what you're talking about.
Right, right. Even though he's a combat veteran, but for his reasons, he just didn't pursue that. So, but that seems to be a course of action that one can pursue, but it would have to come from the primary care clinic.
Was you married? This might not be my business, but was you married to him when he served?
No, sir, I was not. I was 13 years old, or he was 13 years old when I was born. So when he was in the service, I was like 5 years old.
Oh, okay, okay. Well, the reason why I was asking, I wish that everybody else that I have spoken to in the last week would have spoken to me just like you and I had a civilized conversation. I learned so much from you, and I am in complete awe and appreciation for you, not just as a nurse speaking with me, but you as a wife of a Vietnam veteran who strongly advocates for him. And
I appreciate that.
And that is one of the things I preach to everybody, is that we all have to be an advocate for ourselves, because the best source of information that a doctor can get information from is actually the patient. So with me, with no family available with me, I tell young people, if you got family, cherish them. If you got problems, get over it, because going through life with cancer is by yourself is no fun. So
I'm sure it's not.
So thank you for what you do, and thank you for being an advocate for your family.
Well, thank you, Mr. Hudson. I appreciate that. And, if I can help you in any other way, just call, okay?
Thank you very much.
And I appreciate you, sir.